Hello and welcome to this session. My name is Smriti Khera and I'm the Senior Director for Life Sciences at Innovaccer. Today we're going to be talking about accelerating innovation at the intersection of biopharma and healthcare. We all know that digital innovation is occurring inside biopharma and inside healthcare, but that these initiatives are somewhat insulated from each other. A largely untapped opportunity exists for connecting these siloed efforts. To talk about this, I have with me the CEO of Innovaccer, Abhinav Shashank. Welcome, Abhinav.
Hey, Smriti. Thanks for doing this. I think this is a time where digital health is basically up for disruption. So, really, right timing for us to basically be talking about it.
Let's get started. Abhinav, what do you think has been the secret sauce of digital transformation in other industries? And what's your view on the digital transformation of healthcare?
Yep. So I think if you rewind back the last 10, 15 years, Smriti, right, like everything around us has changed. Like if you talk about transportation and taxis, like you remember the days where we were all basically frantically wanting to go to the airport and calling someone that, hey, like I really need my taxi at this point. And today, basically, like if you think about transportation, like anywhere you want to go, like it's a click of a button, and here is someone right at your doorstep, and like you're going to go. Entertainment changed on its head, trading changed on its head, music changed on its head, retail changed on its head.
Mhm.
And I think a lot of this transformation has really been like incredible experiences for consumers.
Mhm.
We started with like thinking about consumer as the central point, and took digital and cloud technologies and really created experiences that can transform the experience of the consumer from that perspective. The same hasn't really happened in healthcare, and I think that's basically like the opportunity that lies in front of all of us, that the thing that's most meaningful for us over the as we sort of like live our lives, which is how people take care of us when we are sick, that's not gone through the same transformation. Even today, when you are going to the doctor, the first thing that you're doing is writing on a piece of paper what your name is and what are like the five things that you're basically like sick within general. So I think there is so much opportunity for digital transformation that is up for grabs, like in healthcare, and the people who are basically going to go drive that are just going to reap like massive benefits out of it, and all of us basically as patients and consumers are going to win at the end of it. And I think like as we sort of like look about some of these things on how people went about doing this as well, right? Like I think a lot of this was built by people focusing on what they did really well, right? Like Uber really knew how to get drivers and how to basically get people to sort of like come to the app and really like book a ride. They didn't want to sort of now create like a locational infrastructure, data infrastructure, and all of those type of things. And if they really started from scratch on building a lot of those things, that service would never have existed in general. So innovation in all of these areas and industries, whether that's Uber, whether that's Spotify, whether that's Netflix, Viva, Zillow, all of these industries really leverage like an underlying informational platform, Google Maps in some cases, AWS, Twilio, Stripe, like in other cases, and then basically took all of those things and then focused on how do I add value to consumers in general. And that's where like I think most people focused, and because of this underlying platform that sort of existed, they were able to do it much more quickly, much more cheaply, and were able to sort of like scale globally. If they really started from step zero, which we all have to sort of like do in healthcare today, they would never have gotten there.
Mhm.
Because they started at step seven because of an underlying platform, I think that's the key reason why some of these things are in existence, and the lack of this thereof in the healthcare industry is like a pain point for us for sure today.
Yeah, I couldn't agree more. So, can you go a little bit deeper into what's your perspective on what are some of these challenges in healthcare which has kind of impeded this type of transformation? You talked about step zero, started having to start at step zero. Can you provide us like a little more detail on that?
Yeah. So I think if we look at healthcare generally, right, like our healthcare information, we've invested tens and probably hundreds of billions of dollars over the last few years to digitize like healthcare information. Like we've got electronic health records, we've got electronic claim systems. Like so, it's not that there is paucity of healthcare information today. It's just that it's stuck in so many different silos, and there are no standards in which you can basically like bring it back together. It's like the day and age where maps existed on S3 and NASA and all of these different places, but Google Maps basically then like went ahead and created this layer and bringing all of those things together and opened it up as an API.
Mhm.
That does not exist in healthcare today, right? Like the information exists in so many different silos, but for anyone who is wanting to build on top of it, create digital innovation on top of it, it's just not available in a standard framework for them to go access and build software on. So I think that's been like a big problem. So everyone who is going to start like a digital health team, the first thing that they go running doing is, I need to connect to all payers, I need to connect to every EHR system, I need to go connect to like all of these devices, etc. And before you know it, you've spent like $50 million and not gotten the first consumer in. It's just painful, and like there is no way digital health is basically going to break out unless you solve these problems as a service and offer it as a platform in general. So I think this is basically been healthcare's fundamental problem. I think if you rewind back a couple of years at JP Morgan, I think there was an article on Becker's which said it's the platform stupid, which basically said that the missing link of healthcare innovation and why we haven't sort of like taken the leap that other industries have taken is that there is like this data platform that's been like missing, which provides standardization and ability to like further innovate.
Makes perfect sense. So, what do you think of all this digital health that's going on? Yep.
Yeah. So I think it's starting to happen, right? Like we're all starting to see. Livongo was probably like the first breakthrough that we all sort of like saw. That here was basically like one tiny sliver of what we think of healthcare. It's a large problem, but chronic condition management on diabetes. But they picked up one like tiny thing like in healthcare and really created like a massive company out of it, and that opened everyone's eyes that okay, like this is possible. Like you can create patient experiences throughout the journey, help them manage their disease better, and do it digitally and at scale. And you don't have to basically be in one region. Like you don't need to be just in California, you don't need to be just in New York, you can be national suddenly,
Hmm.
right? And that came like very clear, and therefore like so much more is sort of happening now, right? Hinge Health is basically like starting up stuff. We're seeing like so many companies basically come up, and VC dollars and private equity dollars starting to like go into like digital health creation in general. So I think the opportunity is
Hmm.
here. The consumers want it after COVID. Once we all sort of like experienced the fact that we can do like healthcare and at least for the basic things on our phone, I don't think that train is basically like going back. So there is basically like a big scope of transformation that's here, and the health systems and life sciences companies and payers and all of the stakeholders, as they sort of like think about their future, I think digital is going to be like such a big part of their strategy for sure.
Awesome. Let's so just to recap, you talked about the lack of a platform and a common platform and everyone needing to start at step 0 wanting to integrate with all the EHRs, but that there are these point solutions that are coming up and the markets are booming for digital health. Now let's talk about Innovaccer. What can Innovaccer solve for in this scenario?
Yep. I think, Smriti, if you like, as we've spoken about this is the most exciting time for digital health in general, and I think like there is going to be so much activity in every stakeholder trying to create what their digital health strategy is going to look like. as we sort of like do that, I think our general mission is to enable a lot of that to happen much more quickly and much more faster. By And how do we do that? By creating this standard data infrastructure layer, which really helps people to be able to start from step 7 rather than starting from step 0. That's basically the mission that we are on. And if we are going to be successful over the next few years, we hope that tens and hundreds of unicorns get created on top of our platform, and we really get to see a lot of digital health being created right now today, and offer like so much better experiences for patients altogether.
Tell me a little bit more. Tell me what specific services, and just a little more detail on that.
Yeah. So I think we're now starting to see a lot of these companies really creating products and solutions like on top of our platform. We now have like someone building fraud, waste, and abuse solutions. Now have someone building clinical decision support suites, like tens of those suites, and then people are building like digital diagnostics solutions. People are starting to build diabetes management solutions, and it's fascinating to see that when they are starting from that level where all of the data problems are not really like existent, they are really doing cool things so quickly. uh, and it just basically becomes like the most exciting thing to see that like you created this ecosystem on which people are able to innovate so much more faster. So I think we're very very excited about that part. And as we sort of are seeing some of those things happen, this basic layers of data integration, unified data models, measuring health outcomes, having basic workflows and SDKs like up and running. Don't If digital health initiatives and companies don't need to basically innovate on all of those fronts and take something which is like already up and running the way
Mm.
they took AWS, and not basically set up their own data centers. I think that's going to be like a fantastic shift in healthcare, and we hope like we are going to be able to sort of like do that quickly and fast over the next few years.
Give us an example then. Give us an example of something we're building with the Innovaccer Health Cloud, and also, where does biopharma fit into this vision?
Yeah. So we just partnered with Roche, I think a few months back, and I think they're one of the global leaders in drug discovery, as well as basically like caring for the patient in general, and on a fantastic mission. And as they're thinking about digital and how do they sort of like really take up the
Mhm.
next step, when we started discussing with Roche, the collaboration really came to the point that hey, like you guys have this standard platform on which we can build applications. More and more science is evolving so fast that caregivers need like more access to this science at the point of care. If we wanted to build more and more of these provider insight solutions, we want to build it on a common framework, on a common platform, and on a common data model. So they used basically like our standard data model and our standard platform, and they are now basically developing like multiple provider insight solutions very very quickly. And I think that's the power that the platform sort of like gives, that you don't start from step 0, that I'm going to take like all of this like EHR data, all of this claims data, etc., and then start mapping that, etc. All of that would have been a 2-year exercise. Instead of that, starting at step 7 and really adding value very very quickly and launching like the first product within 3 to 6 months is where like I think all of the magic sort of like life. It gives you the ability to experiment faster, it gives you the
Mhm.
ability to build more solutions more quickly and take them to market more quickly. So I think this is where like I think like Roche and our partnership, we're very excited about what we can sort of like do on this over the next few years. But that's how we are kind of really envisioning some of this playing out.
And then tell me about, how does biopharma fit into this? How do you see care innovation and care delivery and then care reimbursement together?
Yeah. Now, I think if you think about this entire thematic, Smriti, like if you are going to be able to create this open information ecosystem in some way, that data is more liquid, you have like APIs, they're all basically structured in that way. What it sort of like creates is this virtuous circle of like a learning ecosystem. You can now finally have like payers, providers, life sciences, and medtech companies all come together and really drive like one thing together. Like rather than looking like silos wanting to do different things, they can all sort of like come together on one common framework and platform and care for the patient. This hasn't basically been possible because when you look at providers, they use a very different system, which is like an Epic or a Cerner. When you look at payers, they use like something else, which is a Trizeto or whatever. When you look at biopharma, they are on a different system. So collaboration across some of these things and really driving like patient impact together is not really a possibility on any common platform. And if we are able to sort of like build this framework, information framework, which it just leads to creation of an ecosystem which will drive like so much better patient experiences, and not everyone is basically trying to sell their own transactional product in some way. And like so I think that's going to be the big theme that hopefully we are able to unlock with this, but would love to kind of really like get your thoughts on this as well.
So from my seat, I think the Innovaccer Health Cloud has a few distinct features that really lend themselves to innovating at that intersection between biopharma and healthcare, and also the intersection between med tech and healthcare. So, first and foremost, our data activation platform can integrate the disparate silos of health information, like you talked about, and synthesize a longitudinal, comprehensive patient record. That's really the core fundamental. Second, we can surface both clinical and operational insights through our analytics. Then, third, we have out of the box apps that folks can leverage to engage with care teams and clinicians and provide them with contextualized information about their patients. We also have apps out of the box that can help care providers engage directly with their own patients. And then lastly, we have an innovation toolkit, and we invite developers to come and build upon our platform to help us solve the biggest challenges in healthcare. Like you said, we want to be that platform layer that helps to solve the big problems starting at step 7. So to me, this sort of unique platform approach that you've described can really help biopharma go beyond just drug discovery and think of being truly disease management companies and really transform healthcare as we know it. So for example, currently the industry will launch or bring to market a drug, and it might be accompanied by a one-off digital solution like a companion app or a digital therapeutic. But often, the expected benefit is not achieved or not fully achieved, and the ROI of these point solutions is not clear, just as you've described. Or there might be patient adoption challenges for the very same reason. And However, if we start to think about this as a connected digital disease management ecosystem that leverages the longitudinal patient record and is connected to the clinical operations in partnership with health systems, as you've described, right? So with the health systems as a key stakeholder, now you can start to think of different apps that can be connected into this digital ecosystem, to help with things like patient support, clinician training and clinician support, um, remote patient monitoring, generating point of care alerts in real time. And then over time, you start to generate insights, create, of course, value evidence, but also generate insights to feed back into your R&D organization. Again, to keep that wheel turning of medical innovations faster and faster. So, to me, this foundational connectivity that our platform offers to connect to both care operations as well as patient record can really help improve clinical outcomes, but most importantly can help the companies redesign the experience for the patient as well as for the caregiver and the clinician.
uh, that's something that we have really felt that so many of our healthcare stakeholders are basically like transaction oriented, and it's the economic issue basically on how healthcare is delivered, right? Like it is always been like this transactional model, like go fee for service, you go to the doctor and you get paid for that. I think that changing from that to a more longitudinal care delivery model, in general, I think that is going to be the most fundamental change, Smriti, like as you had mentioned, like that's going to happen in healthcare. So I think I'm really excited about this entire theme, as you sort of like mentioned as well. And I generally think like our biggest change that we are going to see in the industry, that it's not going to be about products and transactions. It's
Mhm.
going to be about like continuous healthcare experiences that companies deliver over the next few years. And as they do, like that's going to be so much like more meaningful for health outcomes for each one of us. So I'm super excited. Thank you for having me here, and it was hopefully like a fun conversation for everyone.
Thank you so much, Abhinav. That's all from us.